birth, and babies. But first, I have to give a huge shout out to your awesome leader, Lisa. Like, she is cream of the crop, above and beyond. And she, worked this out to get me on your call. And I am so grateful to be here. And you are so lucky to have such an amazing leader like her to pull this together and to have so many people on this call. I do lots of Zoom calls, but there's not often even this many or from all over the world like this. And so huge kudos to you, Lisa, and to your team. So I have to talk fast because I have so much information to give you, and I want to give it in a timely manner so you're not here with me all night. But I want to give it all to you. I want you to know all the things. And so, but let me just start out by telling you a little bit about myself, how I got started, and why you should even listen to me. So I started using oils in the 80s. But I never used them in my practice, in my midwifery practice, because I just wasn't that confident with the oils. And there wasn't really much information out there about using them with pregnancy and pregnant moms and babies. And so I was really very conservative. And I had a negative reaction to one of the brands I was using. So I just kind of quit. And then a friend of mine called me in April of 2008 and said, there is a new oil company out and you have to smell these. They are so far past anything we've ever had. And I knew in that moment, even in talking to her, some of you may have experienced this, I got those tingles from head to toe. That was my confirmation that these were exactly what I was supposed to do. And so I ordered the biggest kit doTERRA had back then, which was $500. It was all oils, no supplements, nothing. It was just all oils without even smelling them. And I told my friend, just so you know, I'm delivering 5 to 6 babies a month. I know this is a marketing company and I don't have time to do this as a business. I'm just going to use them for me. And so I'm just telling you right up front. Well, I remember getting my oils and I spread them all out in my front room. And I was opening up the bottles and smelling them. And when I smelled frankincense, I was blown away. It was like nothing I had ever smelled before. And I thought, there is no way I can keep these to myself. And so I called my friend. Okay, I changed my mind. I'm all in. And I can tell you that 100% of my clients are enrolled because I would let them know, that these are amazing. Essential oils are my expertise and passion. And when you call me on the phone with some ailment or something going on, I'm going to refer you to essential oils. And so I would gift them all with a trio of lemon, lavender, and peppermint, tell them how to use them. And you can use those oils from beginning to all the way through menopause. You can use them through pregnancy, through childbirth, through with your babies, all the way through, totally safe. And so I would tell them how to use them. And by their next visit, they were on board and ready to enroll. And then when we got the supplements out, well, that was a no-brainer. That was, doTERRA will never label those our Life on Vitality as prenatal vitamins, but in my opinion, they are the best prenatal vitamin out there. And we're going to talk a little bit more about that in a minute. But I had, so that was kind of how my doTERRA journey got started. When I lived in southeastern Arizona for right down by the Mexico border for about 24 years. And I had a thriving midwifery practice down there. I moved up to southern Utah about 5 years ago, but that's in Arizona is where my thriving practice was. And I would travel anywhere like a 2.5 hour radius, anywhere but south. South was Mexico. And so I would travel, all over. So if I had a birth over here, 2 hours. And then in the same day, I would get called over here to another birth. And that was like a 4-hour drive from over here. And so I had to really be on top of it. One day, I remember I got called in the middle of early in the morning, in the early hours for a birth up this way, about 2 hours. And It was a first time mama. She delivered, everything was great. And just as we were finishing up that birth, I got a call for a mama that was having twins, and she was in labor. So we finished up this one. I went to the next birth. We had twins. All went well. And I remember it was about 11:30 at night, and I was walking out to my car, and my phone rings again. And now I get another mom that's in labor clear over here. So I am driving now another 3-4 hours over here in the middle of the night. And I remember just laughing, like, when would this ever happen? So that was 4 babies I delivered in one day, not in one day, but in a 24-hour period. And those days were crazy. And essential oils were, like, for me, just a lifesaver. I remember the very first time I used essential oils at a birth. And it was a mom that had some previous history of some abuse. And so I knew I needed to be 100% present for her, 100% grounded. So Balance was the oil that I chose. This is, again, the first birth I ever used oils at. So I put some Balance on me, and I put it on the back of my neck and behind my ears. And I went to this birth. And we were sitting outside, and I was rubbing her back, and she was swaying. And every time she'd sway close to me, she would kind of nestle her nose in my neck. And I thought, oh, she's smelling that Balance. And so I just held that space for her, didn't say anything. And soon things were progressing. It was time to go inside. She was doing a water birth, so she got in the tub. And as things progressed, she started having a panic attack. And she said, Stephanie, I need you near me. I need you right here. There's something, I smell something that I need to smell right near you. And so, of course, I knew exactly what that was. I sent my assistant out to my car, grabbed my oils. All I did was took off the lid from the Balance and just held that right there. And she was in the tub, and she'd sway in the tub. And every time she'd sway near that Balance, she would take a whiff of that. And about her, and we had a perfect birth. Everything settled down. It was a beautiful birth. And about her 3rd day postpartum visit, when everything had processed and things had calmed down, I was there visiting with her. And I asked her what was going on in that moment. And she said she was having flashbacks from previous abuse. And those sensations of when you're in labor and pushing out a baby are very similar. And she just couldn't handle it. And so she said it was that oil that helped me stay right there focused in that moment. And she had no idea what she was smelling. She had no idea. She just knew that oil kept her focused on that moment. And isn't that what Balance does? It keeps us from worrying about the past or the future. It's right here, keeps us focused on that moment, grounding. And so I learned from that birth that never am I at a birth without Balance. So, and that's how I learned about using all of the oils. When I had another babe that mom had a hard time pushing. Baby was really big, and his shoulders got stuck. And so just his head was out for longer than what I would like. And finally we were able to maneuver baby, and he was born, but he was not a happy camper. He was I could tell it was a very traumatic birth for him. And so I'm thinking, okay, what oil is calming? Lavender. So I grabbed my lavender and I put it on the bottom of his feet, and it didn't really do anything for him. Okay, what else? Roman chamomile. So I got my Roman chamomile, put that on the bottoms of his feet, and it didn't do anything. And so I'm just like praying, okay, help me to know what to do for this baby, because he was so distraught and crying, and his eyes had been, rolled back, and he was just not present. And instantly the thought frankincense came, but it wasn't to put it on his feet. It was to put it on his crown and down his spine. And so I did that. And within seconds, this baby stopped crying. His eyes came back, totally focused on me. I could just see him looking deep into my soul and saying, thank you. And so I learned from that birth that, okay, I'm never at a birth without frankincense. And if you've read any of my stuff, that's one of my protocols at a birth. Every baby gets frankincense down their spine. Every baby gets balance on the bottoms of their feet, because that helps keep them present in this, on this side of the womb. And so between those experiences and many conversations that I had with Dr. Hill and Emily, that is how my book, Essential Oils for Pregnancy, Birth, and Babies, came about. Because, one of the questions I'm asked mostly is what oils are safe for pregnancy, to use in pregnancy and with your babies. And I'm going to say there's going to be so much information written out there about what's safe and what's not. And that's because they are writing that information for all oil users. They have all oil users in mind. And so, but doTERRA is different. So even doTERRA is mindful of the species that they use. When Yarrow Palm came out, Yarrow is a oil that I use for, or an herb that I've used in delivery to help expel the placenta. And so when Yarrow came out, I thought, that's not good for pregnancy. I don't want to use that in pregnancy. But everyone was talking about it, and Emily was just everybody was just so excited about this Yarrow. And I hated to say, sorry, you can't use that in pregnancy. And so I had done some research, and finally I called Emily and I said, okay, Emily, help me out. Help me understand about Yarrow. Because in my experience, this is how I use it, but I'm hearing you say differently. And she says there are two different species of Yarrow. And so I'm just going to give you the easy version. I'm not going to go into any scientific names, but there's a blue and there's a green. The green is not safe in pregnancy, but doTERRA uses the blue version, which is safe. It's a species, and I can't remember the name, but it's blue. And so doTERRA was very mindful. They chose this blue version species that is totally safe to use in pregnancy. And in fact, it's super helpful in pregnancy. Same with cypress. Cypress, there are different species. One is not okay in pregnancy, but doTERRA cypress is totally safe. And again, I use cypress all the time in pregnancy because it's so great for circulation. And so again, doTERRA is different. They're different in not only that they're pure and where they're indigenously sourced and what time of day they're harvested and all the things, but actually the species that they choose they're very mindful of those species. And so it was finally, I found a brand that I felt completely safe and comfortable with. And so I would have all these stories and all these ways that I had used them in pregnancy and the different protocols that I had used. And, I kept hearing, you need to write this down. You need to, because it's not out there anywhere. There's not that this information isn't really out there anywhere. And so that's how my book came to be. And so everything that you read in my book, on my social media, on my ebook, any information that I put out, know that it comes from my personal experience. So somebody emailed me yesterday, how come does Modern Essentials say that oregano isn't safe in pregnancy, that I should avoid that in pregnancy? And you say it is. Well, it's because that was written for really Modern Essentials the Modern Essentials is a doTERRA brand, but really they were a company way before doTERRA came about. And when doTERRA came about, they took their books that they had for other companies and now branded them to doTERRA. So that's why you will see different information. In my book, I specifically use doTERRA, and it comes from my own personal experiences and many conversations that I've had with both Dr. Hill and Emily in different protocols. UTIs are a big deal in pregnancy. If someone has a UTI, that can lead to other things very, very quickly. So I want to make sure that that's taken care of, instantly. And so I have a very strong protocol for UTIs, but that came about from a sit-down conversation that Dr. Hill and I had. Okay, this is what I have going on. I can't have I need to be able to address this with my clients. What can I use? And so together we came up with a protocol. So again, all of this is, I'm very mindful and, from my own personal experiences and what you'll read. So there is that little bit and how I, kind of started using the essential oils. However, I know we're an essential oil company, but really nutrition is the foundation for pregnancy and our health in general. And so I start off by the Life on Vitality. Life on Vitality is like doTERRA will never label it as a prenatal vitamin, but it is the best prenatal that I could recommend. Let me tell you why. It is a whole food supplement. So most of your prenatals or your prescription prenatals will be a synthetic prenatal. The ingredients in there will be synthetic. A whole food supplement comes from whole foods. So like folate comes from lemon peel. You'll see that all the ingredients, they will be whole foods ingredients. So the difference is is, say I get a text on my phone and I'm reading it like this, and I can read it every word and get every word just fine. But if I turn that around into a mirror and now I'm trying to read it, now some of that is going to get lost by the wayside. I'm not going to be able to figure all that out. I might get the gist of it, but for the most part, there will be some of it that I don't get, and it will just be thrown out. That's the same with a synthetic vitamin versus a whole food vitamin. A whole food vitamin, my body knows exactly what to do with that, how to process that, and where it goes in my body. A synthetic supplement, your body has to convert that and then figure out where that goes. And some of that conversion gets lost. Sometimes our bodies can't convert that. And so some of it just kind of floats out into our bloodstream and turns out to be toxic. Some of it we pee out. So it's like expensive pee. Whereas the Life on Vitality supplements, you get every single bit of that. You absorb all of that. So that is one of the reasons that I absolutely love that. Your omega-3s are in there, are your brain food. It's for your brain activity, and you're creating a human that has a brain. And so that is so, so important. Other supplements that we have that are important to go along with that Life on Vitality as part of my everyday routine are the enzymes, Terrazyme, again, a whole food enzyme. So your body knows what to do with it. Our bodies produce enzymes. And they naturally produce enzymes. There's some of those enzymes go to help digest our food, and others go to help rebuild and connective tissue and a plethora of other things that goes on in our body. The problem is our food is so it's not the quality that it used to be, and some of us don't eat as healthy as we should. And so it turns out that all of our enzymes that our body produces has to go towards our food. If we can help supplement those enzymes for our food, then the other enzymes that our bodies naturally make can go to all the other jobs that enzymes do in our body. So on the bottle of Terrazyme, you're going to see the dosage will be 1 to 2 tablets or 1 to 2 capsules with a meal. I'm going to tell you, really look at what you're eating, look at your plate of food, and then decide how much you need. Fruits and vegetables have all the enzymes they need in them to digest them. But when we cook our vegetables, now we cook those enzymes out. And meat doesn't have any enzymes in it at all. So if you're having a salad, and that's all it is just a salad with veggies, good. You're good to just have, one enzyme with that. You put dressing on it, so one enzyme is good. But now let's say you're doing like a Cobb salad or even a Caesar salad. So now you're putting cheese on it. You've got dressing, you've got your grilled chicken and anything else that you put on it. Now you're going to want to increase those enzymes to 2 or 3. Now let's say you go out to a Mexican restaurant for dinner, or you have a steak and a baked potato and steamed broccoli. Now you're going to want to increase that to like 4 enzymes, 4 or 5. There's sometimes I've taken 6. So depending on what you eat, enzymes with every meal, and look at your plate and see how many enzymes you feel that you need to help break that up. There is a demonstration I've done. Some of you may have seen it, where you have 2 bowls of oatmeal. And you open up one Terrazyme capsule into one and you stir it up. And within about 5 minutes, that one that you put the capsule in is soupy. It's just soup. This one over here, you can put your oatmeal on the spoon and turn it upside down and it won't even fall off the spoon. So that's what enzymes do to in our digestive system, is they help break that food up to make our bodies easily digest it and get it to all the parts, get the nutrients to all the parts that it needs. So Terrazyme, Lifelong Vitality. The third one is PB Assist. So PB Assist is your probiotic. And I love doTERRA's because of the way it's formulated. To my knowledge, there is not another one on the market that is formulated like doTERRA's. It is a dual chamber. So it has a prebiotic that is actually opened up in your tummy, where it can like prepare your body for the probiotic that doesn't release until it gets to the gut, where it can actually do your body good. Your good flora in your gut is your immune system. That's part of your immune system. That good flora eats up the bad bacteria. And so you want that good flora in there. And so again, at least 1 PB Assist every single day. If you've been on antibiotics in the last year, antibiotics destroy the good and the bad bacteria. So again, you're going to want to, if you have any gut issues, you're going to want to increase that PB Assist, but for sure 1 a day. Oftentimes I recommend 2 a day. Again, every single day, not just when you're doing the cleanse. Then we have, so those are my 3 foundation, like everyday foundation. The rest of the supplements I'm going to go over just really quickly. Just know that, supplements can be overwhelming, and I don't want you to be overwhelmed. I want you to be successful. So know that they're safe, but you don't have to take them all. You can take them as needed. GX Assist is the one soft gel that I recommend to avoid during pregnancy and breastfeeding. Not because it's not safe, because if you have like a threat coming on, you feel something, you're getting a little fluish or a little sick, then by all means, GX Assist is a great antibacterial oils in there. So that would be a great one to take. But as a general detox, your body is already working on overtime creating a human. And so we don't want to overtax the body. And so again, GX Assist, just only use if you need it. Otherwise, just avoid that during pregnancy and breastfeeding. Then we have Zenderkin. So Zenderkin they're 2 supplements. I don't know why doTERRA named them the same thing, because they're totally different, but they go together. So the Zenderkin complex, which is the white bottle, it is the capsules that goes in your body and gives nutrition to all of your internal organs. So fantastic to give that nutrition. When our bodies feel like they're given nutrition and they're supported, now they can gently detox. And so that's why you might hear of Zenderkin being it detoxes, because it nourishes your body. Now feels safe to detox a little bit, just gently. Again, totally safe during pregnancy and breastfeeding. Then we have the soft gel. So the soft gel is the same as the oil. So you can save your money and make your own capsules, or have the convenience of the soft gels. They go in and open up your liver ducts so your liver can do its job more efficiently. Our liver has like 400 jobs in our body. And it is it is given the least amount of gratitude. And so when we give it citrus oils, our liver is doing a happy dance. Same with our kidneys. But this, it's like a filter. Our liver has to filter everything that goes through our bodies. And sometimes that filter gets clogged up. So the soft gels, Zenderkin soft gels, opens up those liver ducts so then everything can flow through more efficiently. Again, safe in pregnancy and breastfeeding. DDR Prime. DDR Prime is, everyone should be taking DDR Prime right now with what we have going on with all of the worldwide pandemic. Everyone needs DDR Prime. It is safe in pregnancy and breastfeeding, but let me tell you what it does. So our cells have a life cycle. They're born and they go on this life cycle and they go all the way around, and it's about 120 days and then they die off. Well, sometimes those cells get to be their teenage years and they think they know more, and they mutate off on their own. We've all been teenagers. We all know what that's like. We know everything. And so, but that's when problems occur. And so DDR Prime goes in and gathers up, it binds to those cells that have gone off rogue on their own, binds to those and bring them back to that life cycle to die off. And excuse me, it also keeps those cells that are on that life cycle on it. So you can see how important DDR Prime is. 2 capsules every day. If you have other things going on, other health ailments, you might want to increase to 2 in the morning and 2 at night. But that is a everyday supplement, especially with, again, what we have going on right now. And then we have in my fertility protocol, you'll see I have phytoestrogen and bone nutrient. Those two were our sister products that were created to work together. So we both male and female, I know it's named the women's complex, but really it's just as much for men too. Because we have the same hormones. So we have estrogen is the good estrogen. Xenoestrogens are the bad. And they're racing to get to the cell. The xenos are going to win every single time. They are stronger, they're faster, they're bolder, they're like the bullies, and they're going to win every time. It's a race to get to that cell. And we take in those xenoestrogens every day. The waxy on our apples, some of the products we use, we can't get away from that. And so what phytoestrogen does is it goes in and eats up those bad estrogens, those xenoestrogens. It like binds to them to bring them, to carry them out. So then the good estrogen can have a chance to reach that cell and do what it needs to do, because otherwise there's no chance of it doing that. And that's when our hormones get off balance. So when you use phytoestrogen on its own, you have an impact on like 3 or 4 hormones. When you add bone nutrient to that, now you have an impact on like 28 hormones. So that bone nutrient is like a magnifier for that phytoestrogen. You really want to use them together. Now, I don't know if you've ever tried the bone nutrient, but they are big capsules. So if you are taking Lifelong Vitality, this is one product that the bone nutrient is one product that I can tell you can cut back on. Normally I tell you it's okay to take more. Bone nutrient, if you're doing Lifelong Vitality, you can cut back to just 1 instead of the 4 that is the dosage. But you definitely want to take those 2 together. Again, totally safe during pregnancy if I have someone that is using those while trying to conceive, or then I would have them continue to use that in pregnancy. You could use those for if you're in perimenopause, or if you're in menopause, or even postmenopause. I get questions about like I've had breast cancer, or that I have that history in my family and I'm not supposed to take in any extra estrogen. Phytoestrogen is not an estrogen supplement. Don't get that confused. It's totally safe. In fact, very beneficial in those cases. It's going to bind to the bad estrogens and bring those out. Okay. So again, safe, safe, safe. So we've talked about a little bit of the supplements. We have a few more to go, but we'll talk about those in a minute. In pregnancy, I say 80 to 100 grams of protein. And so because that's going to help with all the other ailments that sometimes come in pregnancy. And so that's hard to do. With Doterra's protein shakes, you can use those as not a meal replacement, but as a meal supplement. So I say get protein in all of your meals and protein snacks in between. And the doTERRA protein powder is fantastic for that. The fiber, the greens, they're all just amazing for pregnancy. So for sure you can use those. Now, everyone wants to know about the essential oils and dilutions and guidelines for those. So, went down the wrong tube. Sorry. Man. So, I want to tell you just to use common sense. So, there is with your mild oils, you're going to dilute 1-to-1 ratio. With your sensitive oils, dilute 1-to-2 ratio. With your more caustic, a 1-to-3 ratio. So those 1-to-3s might be cassia, cinnamon, clove, oregano, thyme. Your sensitive oils might be bergamot, lemongrass, ginger, peppermint. Those might be your sensitive oils. Your mild are going to be like frankincense, copaiba, lavender, Roman chamomile, those kind of oils. So, again, dilution is really important. And you'll notice in my book, I talk a lot about using the oils neat. That's because in the very beginning, we learned, in the very beginning, we had no education whatsoever. I mean, we were on our own. I was truly a pioneer when it came to talking about essential oils for pregnancy, birth, and babies. And we have these pure oils. And so like frankincense or lavender, they're so mild, they don't need to be diluted. Well, then as I used them and grew in my knowledge and experience, I learned really what dilution was all about. So in your diffusers, you have a diffuser and you have water in it, and you put several drops of oil in it, 5 or 6 drops of oil in it. And that diffuser, when you turn it on, it smells the same here when you first turn it on as it does 4 to 6 hours later when it ends. It's kind of like right in the middle, okay, which is optimal for us. When we apply oils topically, we usually have a pain point. And so we apply the oil and so that goes up to the top. Then we have flash off, and then it slowly absorbs, and 15, 20 minutes, 30 minutes later, we reapply. And we go back up, we have the oil at this level, it flashes off, and then comes down, and again, 30 minutes later, we're reapplying. And this is a cycle that we go through. Well, like a diffuser, what we really want is we have that high and low, and we really want the middle. And so we want that oil to stay right in that middle for a longer period of time. That's the optimal place where we want that oil to be. So we don't have the flash off, and we're not at the bottom where we need to reapply. We want it right in the middle. And that's what dilution does. Dilution, when we dilute the oils, it slows down that absorption rate so that we can, so that we don't have the flash off, and it lasts for a longer period of time. So even when you're using lavender or frankincense or copaiba or any of those mild oils, it's always good to dilute because we want it lasts longer. And so therefore, It's less expensive. Our bodies respond better, all of the things. So that's why why we dilute. And in the end, it doesn't really matter how much you dilute. It doesn't matter like 1% or 2 or 10%. You just want to dilute, and you just use common sense. So certainly I'm going to dilute oregano and cassia and cinnamon more than I do lavender or frankincense. Again, you're just using common sense, okay? And then we have categories. So in my book, I talk about categories. Dr. Hill talks about categories, and Boyd Truman has his Symphony of the Cells. He talks a lot about categories, a great resource. But in my book, I talk a little bit about that. So I have a digestive category, a relaxation category, a pain category, a sleep category. So you can divide all the oils up into categories, and you know what, if one doesn't work, you have several other choices in that category to work. One of my I have a family of 3 granddaughters, and 2 of them, lavender or serenity, work fantastic. The third one, that makes her hyper. So she uses petitgrain, and petitgrain will knock her out in just seconds. It's like magic. And so again, use whatever works for you in that category. And that's how I teach. So for instance, if I have a mama that is having preterm labor, typically you might not know what to do about that, but let's break that down. The uterus is a muscle. And what happens when you're having preterm labor? That's a contraction. That muscle is contracting, and you want it to relax. So what oils do we have for relaxing muscles? Marjoram is number 1 on that list. Lavender, frankincense, copaiba, all those, Roman chamomile, all of those are relaxing oils. And so that's what you would use. So even you now can recommend, if someone is having preterm labor or annoying Braxton Hicks, or, contractions when they don't want them, now you know what oils that you might recommend to put on them. We talked about a little bit about that safety. Remember that there's so much material written out there, but that's for all oil users in mind. So doTERRA is different. Oils that I say to really avoid in pregnancy are clary sage, jasmine, hyssops, if you got the Christmas collection and hyssops is in there, and then peppermint when breastfeeding. So not during pregnancy, but when you're breastfeeding, avoid peppermint because it may decrease your milk supply. So clary sage is actually a wonderful oil to help with those hormones. And so it's in my in a hormone harmony blend that I have, which again, in a blend is okay, but by itself, it's not. So picture and imagine you're going into this dark room and you have a flashlight, it's pitch black, and you have a flashlight and you have it pointed at this, the smallest point, and you're looking straight ahead. And you can see with detail what you're looking at with that flashlight, but you can't really see anything over here in your peripheral vision, either side. You only see what you're looking straight ahead. That flashlight has a mission. It's pointed at exactly where you're pointing it out, and you can see very clearly what that is. That's clary sage. Clary sage is on a mission, and it is a direct point to increasing contractions and helping with hormones. Clary Calm is just what it says. It's the clary sage in a blend that calms. So now picture and imagine this very dark room, but you go in and you turn a little dimmer switch on. And so now nothing is lit up perfectly, but you can see everything very gently. So you can see a little bit over here and a little bit over here. You can't see all the details straight ahead, but you can certainly see a little bit. It's very gentle and calming. That's what Clary Calm is. So Clary Calm is totally safe to use in pregnancy. It's very calming. If I have a mom, in fact, I had a mom at 28 weeks. Her first baby, she delivered preterm. And her second baby came at 28 weeks. She's having those contractions again, and she's getting really nervous. and having a little bit of PTSD. And so she calls me, okay, I'm having, these contractions, what do I do? And I can tell she's really nervous. And I said, okay, first of all, what have you drank today? Because dehydration will bring on contractions. And so she had drank plenty, but I said, go get a big glass of water right now. Let's drink that down. And then what have you done different this week? And she said, well, I have been using Clary Calm until this week. And then this week I stopped just because no reason. She just didn't use it. Okay, let's start that again. So we started Clary Calm. Those contractions completely went away. So again, it helps balance out those hormones. Totally fine in pregnancy. Now, in labor, when you get to be full term, now you can go ahead and use Clary Sage because now you want it. You want to increase those contractions to get things going. It's the contractions that bring a baby out. So how you would use that is on the bed of your pinky toe, the inside of your ankle bone, and on your low abdomen. And remember, when you dilute that, you don't have to reapply so often. You're going to just massage that in, and I'm not going to tell you how many drops to use. You're going to do a couple of drops of Clary Sage, put some fractionated coconut oil in the palm of your hand, and use that to massage on your pinky toe, your inside of your ankle, and your low abdomen. It really doesn't matter the number of drops. You're just diluting to make it last longer, to slow down that absorption rate. And so that's how you would use that. Then and I use peppermint all the way through, even in birth. So, and even postpartum. So after you have a baby, sometimes things are numb down there. They don't work very well. And I need mom to pee right away. And so a drop of peppermint in the toilet will, just the cooling sensation will come up and help mom to be able to go to the bathroom. And so a little trick to put on the shelf for when you have toddlers, or when you know someone that has a toddler that is trying to potty train. Again, you can do that same thing. Put a drop of peppermint in the toilet and it works like magic. So makes that training just a little bit easier. Pregnancy tummy tamers. Again, we're going to that category of digestive oils. So that's going to be peppermint, ginger, fennel, digestan, cardamom. Cardamom is one of my very favorites. Cardamom and ginger come from the same family, and they actually block your nausea receptors. So I was speaking in convention one time, and right after I finished, it was the year cardamom actually came out. And so I was talking about it and how great it was for nausea in pregnancy, or for car sickness, or, really any sort of nausea. But anyway, I had a mom come up to me backstage afterwards, and she says, I'm in my first trimester. I'm so incredibly nauseated. I have no business even being here. But after I heard your talk, I thought, I'm going to go into the product knowledge room and see how this cardamom works. And so she put it on behind her ears and the back of her neck. And she said, within 5 minutes, that nausea went completely away. It didn't just take the edge off like the others had. It totally took it away. And so, again, now cardamom is oil that I highly recommend for any sort of nausea, no matter what the, where that comes from. So again, growing humans is a superpower, and it is exhausting. So we have Mito 2 Max. Mito 2 Max is fantastic to help with those energy levels, 2 in the morning, 2 in the early afternoon. And it just will help lift you and give you the energy that you need. But there's also 2 parts to that exhaustion. And the second part is getting enough rest at night. And so the Serenity soft gels are fantastic for that. Take two soft gels at night, and again, totally safe for pregnancy and breastfeeding, but that will help you get really a good night's rest that you need. Other oils that might help that I recommend to put like on the bottoms of your feet at night are Roman chamomile, frankincense, and bergamot. Those are like 3 oils that go really great together. And if what I do before I make a blend is I put those oils together, open the bottles and put those together, and smell them. And if I like that smell, I mean, there's a lot more that goes into it, but into what I tell my moms to do, because there's so many, and in pregnancy, your smells, you're really affected by different smells. And so open the bottles and put those together and see if that's a smell that you like. And if it is, then you can make a roller bottle of it. And so again, that's Roman chamomile, frankincense, bergamot, and just equal drops, like maybe 5 drops of each of those in a 10 ml bottle. Put fractionated coconut in it to the top, and now you have a great relaxation blend. Serenity is fantastic. There are lots of oils that are really great, but just another blend. I really like that one. Copaiba is my new go-to oil for everything. There are seriously so many great things about this amazing oil. You will not want to miss out on this gem. It is a must for your birth bag. It's a must for your medicine cabinet. It's a must for your purse. It's everything. So if you see in any of my blends, you'll see, especially as late, Copaiba is in almost every blend because it makes all the other oils work better. So it's like a bridge, so it helps, it like magnifies all the other oils so that they can do their job better. But Copaiba in itself is right up there with frankincense, like super anti-inflammatory, great for nausea, just great for headaches, great for pain. I personally suffer from vertigo occasionally. I do a drop of Copaiba and frankincense under my tongue and then put it behind my neck on that occipital triangle back there. And if I catch it right away, that vertigo will only last a few minutes. So again, Copaiba is, everyone should have that. And it is especially great for pregnancy. At 28 weeks, your blood volume doubles. And so your body has to do a lot more work circulating all of that fluid. And your citrus oils are going to help with that. Your kidneys are doing a happy dance when you give them citrus oils. But also, again, cypress is the number one circulation oil, and cypress is also the number one oil in Aroma Touch. I love the smell of Aroma Touch, so I'm using that. So when you have cankles, and anybody that's been pregnant knows what cankles are when you can't tell the difference between your ankle and your calf, that mixing some lemongrass and lemon and grapefruit and some Aroma Touch together with some fractionated coconut oil and just massaging that into your ankles and feet is going to be great. I do have a blend specifically for that, but those are great oils. Also grapefruit in your water. Really, you can put any citrus oil in there. I'm loving grapefruit and green mandarin. Those are super, super great. And also immersing yourself in water. So when you are, your kidneys have to work really hard when there's that much more to circulate. And so when you immerse yourself in water, your kidneys feel supported. So like, I'm sure you've gone to the bathroom just before you get into the pool, and now you're in the pool and you have to go to the bathroom again. What's up with that? I just went. That's because your kidneys feel supported and there's that even pressure, and now they can really do their job. And so swimming is really good, or just even if you have those swollen feet, just again put yourself in that in that water to help with that. Immortelle is great for the stretching skin, and I do have a blend specifically for that, but the shortcut is Immortelle. Immortelle is a powerhouse blend. So it's got your frankincense, sandalwood, lavender, myrrh, rose, helichrysum. It's great. But I do have a stretch mark blend that has those oils in it, along with a couple more, like Yarrow Palm is fantastic, and it also has Copaiba in it. So you'll again find that in my book. And I'm going to talk about where to get that, and I have a deal for you at the end. So just hold on for just a few more minutes. Also in pregnancy, sometimes we strain our low round ligaments. So we have ligaments that run each side of our low belly. And before pregnancy, those ligaments are about the size of your pinky. and about as round as your pinky. But by 40 weeks, by the time you deliver, that ligament is stretched as long as a pencil and as skinny as a pencil lead. So you can imagine that's pretty easy to strain, even just rolling over in bed or bending down to pick something up. And so when that happens, because it happens almost every pregnancy, when that happens, your oils that are going to support that are going to be Aroma Touch and Siberian Fir and Copaiba. So this is a great blend to make and have you can have it for that low-lying ligament, but also it's a great pain blend that is very gentle. So your Aroma Touch is going to circulate and help that circulation. You need circulation to heal. Your Siberian Fir and Copaiba Siberian Fir is specifically for pain, and Copaiba helps with pain as well as inflammation. So you can imagine this is going to be a great little pain blend for anything, pregnancy related or not. You have low back pain, you have hip pain, you have knee pain, you have shoulder pain, you have neck pain. Again, such a great blend. The exact drops are in my ebook. But again, don't get so concerned about those. It's a 10 ml roller bottle. You got 3 oils: Aroma Touch, White Fir, Copaiba. Do, 5 to 10 drops of each of those. Fill it with fractionated coconut oil, and you're good. One of my best tips that I can tell you for delivery is helichrysum. Helichrysum is like the arnica of essential oil. So it helps with bruising, it helps stop bleeding, it helps with trauma. It just is amazing. Everyone needs helichrysum in their medicine cabinet, but for sure for delivery. So I use helichrysum with fractionated coconut oil to help just lube things up so that baby can slide out easier. And doctors will often use olive oil for this. So you can just request to use your oil, which is fractionated coconut oil with your helichrysum in it, or even olive oil with a few drops of helichrysum in it. It doesn't really matter. But this will help with that tissue that has to stretch to minimize swelling, and also help with bruising on baby's head, because as baby's head is born, its bones have to come together like this. They overlap in order for the head to fit through. And so I imagine that probably isn't very comfy, and helichrysum helps to support that. So one of my favorite stories, just to really tell you that you can do this. My daughter moved from across the country, so from Utah to Florida, and when she was 38 weeks pregnant, and didn't know anybody, had no support system. I flew out the day after they moved there so that I could help them, get ready and get unpacked and stuff. But I was it when it came time to have baby. And so she had a couple of rough births. Her first 2 were pretty rough. So she manifested that she wanted a 2-hour labor with this one. And as long as it's only, as long as I manifested, I might as well manifest that I get to sleep all night and just wake up early in the morning with labor and have it to be 2 hours and then have the rest of the day to recover. So that's what she did. And she also manifested an easy postpartum and recovery, because she had struggled with that in the past. And so sure enough, on this day, early in the morning, about 6:30 in the morning, my little 5-year-old granddaughter, Caitlin, came in and woke me up. Gee, hurry, come quick. My mom needs you. And so I hurry and get dressed and go out, and she is on the toilet, and I can tell she's in transition. And she says, I need a smoothie. I need some energy. I need a smoothie. Ashley, I don't think a smoothie is what you need right now. And no, I do. And so I went in the kitchen and whipped up the fastest smoothie I've ever made and came back. And nope, that was not what she needed, because by this time she was throwing up. Smoothie went to the side. We moved her to the bed where she was, planned on delivering. And her husband was behind her, supporting her shoulders. And their little 2-year-old was awake by then, so she was up sitting, back here by the headboard. And my little 5-year-old granddaughter was my extra pair of hands. And she said, "What oils do you need, G?" And I says, "I need some helichrysum. Can you put that in this little bowl?" And so she put some helichrysum in there. She says, "How many drops?" "It doesn't matter. Just put some drops in there." So she's putting drops in there. And she says, "Do you want fractionated coconut oil in there?" "Yep." So she put some squirts of fractionated coconut oil in there. And by this time, her dad says, "Caitlin, do you want to come up here and help me from up here?" "No, it's okay. I can see just fine right here." And bless her heart, she was my little helper. And we had a baby by 7:30. Ashley got her 2-hour labor and birth, perfect recovery, easy postpartum, no postpartum depression. And so I tell you this story for 2 reasons. For one, if a 5-year-old can do it, any of you can do it. Don't get caught up in how many drops and how much dilution. Just use common sense. And there is power in manifesting. Don't ever underestimate the power of manifestation, because she was able to have this perfect birth, the story that she wanted, and so well deserved. So again, that's just one of my favorite stories to tell. One, because it's dear to my heart, because it was my little granddaughter that I shared this birth with. And so I was super happy to do that. But anyway, so now we move on to postpartum mom. So oils to help for moms that, right after you give birth. There's a lot of hormones going on. It's a roller coaster. There's lots of shakes. There's after pains. So when you have, after you have babies, so you have your uterus, and the placenta is attached to the inside of that uterus. Now the placenta releases and comes out, but you have all these blood vessels that were feeding that placenta, and they're just kind of hanging out. And so you need your uterus to contract to act like a tourniquet on all those little blood vessels there. So your body does that naturally. That's those cramps that you feel right after you deliver, and they're not fun. And you don't get a reward at the end, because you already have your reward. It's in your arms. And now you have a nurse that comes in and massages your belly and makes it even worse. And so there are oils to help that. So Clary Calm, again, that calming oil, it's going to help balance those hormones and help with those shakes. And then Siberian fir, lavender, Copaiba are all going to be fantastic for that, just to help with the pain of those contractions. It's not going to take it away. It's not going to relax it enough that it doesn't contract and do its job. It's just going to help with the pain. And those oils, all of those, Siberian fir, lavender, Copaiba, are all very gentle. So if you're doing skin-to-skin contact and, baby drops down a little bit, or a footling drops down, then you're totally okay. Those oils aren't going to have any negative effect on baby's skin. They're all just super calm. Again, you're going to want to dilute those to help them to last longer. And then Immortelle makes a great peri spray. So I would take an empty 15 ml bottle and put just a quarter of an inch of Immortelle in the bottom of that bottle, fill to the top with either witch hazel or even fractionated coconut oil, and put a spray top on it. And then every time you go to the bathroom, and do a little spray, and that will help heal that perineum area and just help soothe it and help it feel so much better. So oils for baby. Again, right after baby's born, I use frankincense down the spine and on the crown of the head, and not for any anointing, purposes or anything like that, just because, first of all, it helps with bonding, and it just helps all of those, all of the things that are happening in baby's body, all the transition that happens from breathing in water to now breathing in air, all of that. It just helps that transition go much smoother and easier. Then I use myrrh on the umbilical cord. So myrrh is like a liquid Band-Aid. And that umbilical cord, once it's cut, it has a direct access to every system in that body. And so I want to make sure that it's sealed and no little microbe can get in there and make baby sick. So myrrh is my oil of choice. And myrrh is really thick. So I'm just like kind of tapping it on my finger, putting a little fraction of coconut on there. Again, just a drop it just so it's like pliable, really. And then I just massage that on the tip of the umbilical cord and just right around it. And I usually do that on day 1 when I'm there. And myrrh isn't often an oil that like a mom new to oils has. And so then I do it again on day 3. Usually that cord falls off on day like 4 or 5, as opposed to 2 weeks down the road. So oftentimes it takes cords a while to fall off. With myrrh, it's very drying, so it helps dry it out as well as protects it. Balance on the bottom of baby's feet. So, babies have been inside this womb all nice and cuddly and warm and familiar and hearing your heartbeat and safe. And now they're born into these bright lights and cold, and you're putting these clothes on me. And I'm sure that some of those babies want to crawl back up in sometime. And so balance helps ground them to this side of the womb and just helps them feel grounded and safe. And so balance on their feet. And then Melissa, I could do a whole talk on Melissa. Melissa is amazing. Melissa helps repair DNA. And so when babies are in the womb, they know what's going on the outside. They know the stress, they hear the arguments, they know what's going on. And so even if you're a family of three boys and you just really want that girl and you go for the ultrasound and it's another boy, and for a split second you might think, oh, dang. And then of course you're happy and it's all good. But for even that split second, baby knows. And so Melissa on the bottoms of their feet, just a scant drop. So when I say a scant drop, I'm doing just tipping it upside down on whatever is on your finger. So I would do that on the bottoms of their feet with, again, a little bit of coconut oil and just rub that in. And actually, I do it after Balance. Balance already has coconut oil in it. So I just do it with Balance in it and just rub that in. And I just know that's doing that baby good. And just so you know, it's never too late. So all of you, I challenge all of you to do a Melissa challenge. Do a drop in the palm of your hand, take your thumb and rub it around and put it at the roof of your mouth and just massage your roof of your mouth. Try that once. Try it for 30 days and see what changes in your life. Just do a little journal every day. That is the Melissa challenge. And I love Melissa. It is a fantastic oil and one to definitely use. So then we move on to well baby care. We have again, moms by this time have their own oils. So I'm recommending frankincense on their spine every day. Frankincense is a natural immune booster. Also, of course, we have the kids collection, so stronger is great, but frankincense is just gentle, and I love frankincense. So frankincense down the spine and Balance on their feet every day, just like you would give baby a bath and all the things you do with baby every day. That just is part of that normal routine. Sometimes babies get a little jaundice. That is their body their liver trying to break up the bilirubin, and it might be in too big of particles, and so it might struggle with that. Again, that liver has so much work to do. So geranium is a great liver support, as well as your citrus oils, but geranium is fantastic for that. So if your baby is presenting a little bit of jaundice, a little yellowish skin, maybe the whites of the eyes are a little bit yellow, then geranium on the bottoms of their feet at every diaper change. And if you don't have geranium, lemon works well too, but that liver just needs a little extra support. And then oftentimes babies are, they get a tummy ache or they have colic, like nothing helps them. So first of all, the number one thing I say is if you're breastfeeding, for mom to go off all dairy. Dairy is the biggest culprit for tummy aches in babies. And so cut out that dairy, and then Digest and Touch, or the kids Tamer blend. I also have a Tamer blend in my ebook. So those are that will help with those tummy aches. The belly button is the sweet spot. So you're going to rub it around the belly, but make sure you get it in the belly button. And also the shins, believe it or not, when I have a babe that is having a hard time, they're constipated or have the tummy aches or have gas, when you put that on the tummy, but when you also just massage it on the shins, that helps also. Diaper rash, so helichrysum, Immortelle for sure diluted, because Immortelle is not diluted. That's a full strength, even though it's in the roll-on, it's full strength. So make sure you dilute that. Or doTERRA's diaper cream is fantastic. And then teething, we have Copaiba and white fur, two amazing anti-inflammatory and pain oils to help with that teething. And again, you can just put a scant drop on your hand or make a roller bottle of it. I also have a teething blend in my ebook, but just do a little roller on your finger and put that directly on the gums. Totally fine to use. So we don't use oils really internally with babies, but when you're using it on their gums like that, that's not an internal use, it's an oral use. So again, very, very helpful. So, I've talked a lot about blends that are in my book. Let me just tell you, this book was, I originally wrote it in 2012. I updated it in 2015. And you can imagine there's so much that has come out since 2015. And I kept, getting prodded to update it again. And that just didn't sound fun to me. It's so much work. It's like birthing a baby. And so I thought, I'm just going to keep this as it is. This is a really great foundation work. This has all the details in it, all the information behind the blend and why you would do it. And so this is a great foundation book. But I had an ebook, a mini ebook, and it was about 30 pages. I decided to update that. So that went from 30 pages to 108 pages in English, in 120 or 30 pages in other languages. But it has all of my blends in it. All my blends. I gave it all to you. So I didn't hold anything back. This has just a few blends, but my ebook has all of them in it. It also has in the back a description of the oils, but I formatted them for pregnancy, birth, and babies. So you won't find that information out there anywhere. You can look anywhere and see what, all the uses for lemon, and it's, lots of household issues. But when you look in my book, you'll see all the things that you can use that for, the oils for pregnancy, birth, and babies. Again, it's all combined in one place. So, it's not meant as a replacement for this. It's meant as a companion for this book. And as my gift to Lisa and your team, I want to gift you with a 20% discount code. So when you go onto my website, you can find me I'm the Essential Midwife everywhere. So The Essential Midwife on Facebook, The Essential Midwife on Instagram. My email is theessentialmidwife@gmail. My website is theessentialmidwife.com. Anywhere you can find me using The Essential Midwife. And so if you go to my website, which also has a blog on it with lots of information, if you go to my website, theessentialmidwife.com, you'll see a shop category. And in there, I have my book, my ebook, I have affirmation cards, I have private consult. So if you have detailed questions that you have or are working on fertility, or you want to grow your business more and do it how I've done it with my niche, anything, it doesn't matter. I do private consults. I do private coaching. I do virtual midwifery packages. So like typically if you go to your doctor, you get 7 minutes of his time, and that is enough time to do just the clinical stuff. But really, there's so much more to a prenatal. My prenatals last an hour. And so my virtual midwifery package is, you do your appointment with your doctor to do the clinical stuff, and then you call me. We do a Zoom call that lasts, an hour, and we go over all the other things that you've missed in that prenatal. I also have an essentially prepared birth course, which is a childbirth education course. And so it's a 4-week module that you can go in. So you can find really anything on my website related to pregnancy, birth, and babies. And if you type in the code Lisa20, you will get a 20% discount. No caps, no spaces, just Lisa20. You'll get a 20% discount, and that will last you for 1 week. So, and I'm pretty sure, because I couldn't figure out how to just do it for my ebook, I think it's for everything on the site. So no matter what's in your cart, you'll get 20% off. So you are welcome. Okay, do we have any questions that I didn't answer that aren't too personal? It's really hard to really answer too many personal questions, but if there are any pressing questions, if you have some difficult questions, please just get on my website and schedule a consult. I'm happy to do that. Also, I do have a Facebook community. It's called TEM Community. And this is a huge group of like-minded mamas that use my book, that if you post a question and within 10 minutes, you'll have 10 answers to that question. I learned so much from that site. So I created that because in the past, I would get people messaging me and DM me and emailing and texting all the time. I would be answering 100 questions a day. And I want you to have the answers. So I answered every single question. My life revolved around those questions. And finally, I thought, I have to do this different. I have to do this different. So that's how this community came about. And it has far surpassed my wildest dreams of goodness. It has been just so great. So be sure and check that out. That's amazing. I don't know, we have got just a couple of quick questions that I don't think are personal, but please tell me if you think they are. There's one just asking about retained placenta. What would be the best thing to use for that? So that's when you would use your clary sage and jasmine. Both of those together are going to, and you would use that right on the low abdomen and dilute, but you're going to want to really make sure that you massage and get that in there. Those are the two oils. Specifically, jasmine is the one for that. Perfect. I think that was just difficult. There's so many messages in the chat. Just want to make sure I haven't missed anything. And yes, Copaiba is great for milk supply. All you have to do is do a couple. I do have a milk maker blend in my ebook, but the shortcut and it does have Copaiba in it. But if you don't have those oils or don't have that blend, then just a couple of soft gels are fantastic for that, or even just a couple of drops under your tongue or in a shot glass with water. Right, is great for that. And someone just asked about the oils for babies teething that you mentioned. If you could just repeat those. Yep. So that is Siberian fir and Copaiba, and you can use either of those alone, or you can do it together. Or also, I have a teething blend in my ebook. So Siberian fir they're both for pain, both of them. Copaiba adds the little anti-inflammatory in there, and when you were teething, it's inflamed. So there you go. Yeah, and I think this is the last one. Someone still has joint pain from her last birth. What would you recommend for that? Okay, so let's go back to circulation. So Aroma Touch is going to be like any sort of joint pain because your joints need circulation. So Aroma Touch, again, Siberian Fir, Copaiba, Deep Blue is fantastic. And I love to layer Deep Blue and Aroma Touch together, like for low back pain or, any sort of hip pain, any knee pain. Layering works well also. And my favorite two to layer are the Aroma Touch and Deep Blue. And then I always add Copaiba onto everything.
Fabulous. Well, Stephanie, thank you so much. You've given so much to us again this evening, so much fantastic education. We love hearing your stories as well and your heart. So thank you so much. It's been amazing. I know we've run a little bit over time, but thank you so much as well to everyone for staying on. I know that you've found so much great from your comments, so much great education from here. We did lose a few people when the national anthem come on because England's playing football tonight, Stephanie. So,
I tried to talk fast.